for staying with us on the program. Welcome to this session where we will be talking about breastfeeding. Yeah, it is the World Breastfeeding Week. It started on August 1, and lots of campaigns will be ongoing till August 7 and beyond. You know, we can't just limit talking about it because of the importance of it. And so this morning we have a resource person who will be answering all those questions I'm sure you want to ask about breastfeeding. I'm talking about the President, Medical Women Association of Nigeria, IBOM State, Dr. Uduak Usanga. She is our guest. Thanks for joining us this morning.
Thank you very much. I'm pleased to be here to talk about breastfeeding.
It's a pleasure to have you. All right. Breastfeeding. What is it, in case we don't even understand it? Yes. And then why is it so important that the world has to set aside 1 week to throw out campaigns, about it?
Thank you for that question. Breastfeeding, as we all know, is an age-long thing. It did not start now and it will not end now. So breastfeeding is a process whereby a woman puts to bed, and as she puts to bed, the mother should start, we call it initiation of breastfeeding. They should start within the first hour of giving birth. After that, we continue exclusively. That's what the whole world, Medical Women Association of Nigeria, nationally, in the States, the whole world, globally, says breastfeeding is cost effective.
Okay.
It's economically friendly, and it does not affect your personality. Whoever you are, as long as you've given birth, you must initiate breastfeeding within the first hour of life. How? Why? This breastfeeding is protective for both the mother and the baby. When a woman gives birth and she initiates breastfeeding, her body secretes hormone that is called oxytocin. This oxytocin does two things for the mother. It causes contraction of the uterus and involution. When something contracts like this, it will get smaller in size so that it expels the blood that could have been there in the womb and the uterus. So that's how it protects the mother, involution and a contraction of the uterus. And when we initiate this breastfeeding in the first hour of life, the baby will get the first part of that milk, that breast milk, and it's yellowish in color. So one of the myths that I want to debunk here, or misconception, is that in those days they used to say, throw it away. That
really?
It is not white, it's not milk. So our children used to lose that colostrum that contains a lot of antibodies, nutrients that are useful, healthy for the baby. So we in the Medical Women Association of Nigeria, AKWA said, is joining the global voices to say, please let us initiate breastfeeding first week of life. This breastfeeding is a process, and as we keep talking, we are going to talk about position, posture, attachment, the joy, the connection that breastfeeding my baby. The baby will be looking at you, at the mother, and the mother too is happy. She's able to do her normal maternal roles. It also helps to reduce infant death, morbidity and mortality.
Okay, let's take it bit by bit.
Okay.
Let's take it bit by bit. Let's quickly take a look at this year's theme. I can see prioritize breastfeeding.
Yes.
Create sustainable support systems. Yes. Talk to us about that.
Okay, the theme is that which you have said, prioritizing breastfeeding and create sustainable support systems. How do we create sustainable support systems? Medical Women has even brought down the theme home.
Okay.
And we say prioritizing breastfeeding, a lifeline against postpartum hemorrhage. Okay. Prioritizing breastfeeding, a lifeline against postpartum hemorrhage. This postpartum hemorrhage is what I mentioned by saying that it will help that when we start with the first hour of life, the oxytocin helps in contracting the uterus, and it will help to expel whatever was left inside the uterus after the baby has come out, after the placenta has also been delivered. All the remaining blood will be sent out, because any small part of the blood that has remained or part of the placenta will cause what is called postpartum hemorrhage. Post is after, partum is birth, hemorrhage is bleeding.
Okay.
Yes. So when this is prevented, it will make our mothers to stay alive. We are having zero tolerance to postpartum hemorrhage. How? Medical women and all over the world, we know that this bleeding after delivery can be fatal, often very fatal. Fatal in the sense that it causes maternal loss, death, morbidity. As I'm speaking, I will also interject our language, our dialect, so that people that don't really are not conversant or comfortable will understand. So, Ebon tum ya so we know yineba ata our kiredo is a camera indo, so that ide ka modo asio hormone ibo inwe.
Okay.
And we near infection hormones oxytocin ida man isium ama yem foma akai hormone no. The woman is healthy, will not be sick, will not be bleeding, because even we all know that blood is life. So even we all akimina anye and you don't want to tweak and now the mother too, that's oxytocin. Now the baby will also benefit. So how do we create sustainable? It must be sustained, and the support system must be there. The mother will go home. So we are encouraging communities to help the nursing mother, she's not a nursing mother after her delivery, to be able to have time to breastfeed her baby, in the sense that the government in its magnanimity has now increased breastfeeding maternity leave to 6 months. How is it connected to us now? Exclusive breastfeeding, no water, no fluid, no alcohol. Look at the alcohol. It's not permitted. It's not allowed. That's the advocacy. We are creating awareness with this program. Please.
What about the mother taking alcohol?
We don't encourage alcohol. There are things we don't take. Alcohol, drugs, medications, except on doctor's prescription.
Okay.
Because as a human being, the mother might be unwell or ill or sick. So we encourage her at any point in time she feels uncomfortable with her health, please visit the hospital. We have primary health centers that are the closest to the communities. We have the secondary health centers, which are the general hospitals. We have the tertiary health facilities, which are the teaching hospitals. So we don't want self-medication. We don't want anybody to sit at home. The breastfeeding is natural. Is what God has given us. The best meal in the world is that breast milk. It helps the baby to get the best part. So we have to support the mother. That baby did not come from the moon. There is a father. The mother does not come from the skies. It's a family. She has a home she's going to. So she eats. She drinks water. She's happy. You don't carry family load to go and say, give this, give that. We are the ones to support the mother now. That's supporting system at the community level.
Okay.
At the workplace level, the government has helped us with 6 months maternity leave. So you sit at home, breastfeed, eat, sleep, be happy, play, laugh, because you must also be happy to be able to secrete enough breast milk. Another misconception I want to break here is when we say, eka, ufyumman, eka, kai, pami, because how they call on them we don't encourage that, because we should know that whatever we are taking, the baby is taking it as well. Everything we take, the baby is suckling. So it's not right to a baby that is just 1 month old, 2 months, 6 months, one day the mother started alcohol. So don't throw your money and think about the tender organs of the baby. They do another support system. After the 6 months, the mother has started work. You understand? So we are encouraging workplaces to give support systems. Maybe you could have a room, comfortable design, like this place is very beautiful, airy, spacious. You could have a seat that the mother can sit and breastfeed for some hours, for some time while at work. That's after she has returned from maternity leave. Okay. In some facilities, like we do calls, we take night duty, we take calls. The mother is not put on night duty till after about some months, maybe 9 months, and she goes home maybe 2 o'clock. She doesn't stay till that 4, must be 4. Let's encourage mothers to go home, because you're a nursing mother, to go home and take care of the baby after you returned. Another support system that the government has done is to make fathers now to have paternity leave. You tell your workplace that I want me and you'll be given a form, just as we fill form as a nursing mother.
Okay.
As a pregnant woman, no form of fulfill. In fact, now you even take 1 month before delivery, so that you don't develop stress too much before you deliver. So the father about form when you feel my wife is expectant, and during this time I want form, and so you're given 4 months to assist the mother, to assist your wife, to assist your partner, assist your spouse. Because then hygiene must be top notch, because you don't send about in a dirty, unclean, unkempt environment by infection. That's why I talked about that colostrum, the first immunization vaccine. That's what we call first vaccine of life. Okay. Is that colostrum? I guess it don't make it work in those days. So we breastfeed the baby. And how do you know that your baby is comfortable as well? When you take the baby, you will, of course, before you return to workplace, go ahead, you're a nursing mother. Encourage mothers to bring their babies to workplace, crèche. There are also crèche environments. We have schools, facilities who open crèche facilities. So you could take your baby there. But in this circumstance, because some people are not comfortable enough, buoyant enough, economically empowered, so you could bring your baby to the office. If you have taken your baby to crèche, you should be able to express the milk and keep at the crèche facility. Or if you have gone out, we have a lot of breast pump designed now. Okay. Or you could even use your hands. I express as in cup and spoon. Please, we discourage feeding bottle as much as possible because of the rigors of washing and sanitizing it, such that the baby does not have problems of infection.
Okay. Now let's talk about some other issue. I'm sure that you've already mentioned it. The issue of the benefits. You've already talked some about the benefits of breastfeeding for the mother. Now talk to us some more about what other benefits are there for the mother and then for the baby.
Thank you. The benefits for the baby. Okay, for the mother, another benefit is that she's happy. The money they would have been using to buy infant formula can go in to buy food to sustain the mother, because she has to eat well, take enough fluid, water, and fruits, vegetables, a lot of food, all classes of food, balanced diet. Okay, and the other, if she had some other babies before now, okay, money will be channeled into making those children also happy. Okay. You could do other things with their money. And for the mother as well, it also helps in what we call family planning. If you exclusively breastfeed, studies have shown that the mother has been able to do some form of family planning. She might not, it's not 100%, okay, because studies have shown in different parts of the world, during that first 6 months, she might not get pregnant. So it helps in spacing, child spacing. And if you do not want to have a baby quickly after you have resumed or you have started introducing complementary feeds, we encourage the mother to also go to the hospital for family planning services. She will be examined. She will be, after the examination, will know the best method that is good for her. Also, it will also give her time to connect with the baby, because there is maternal connectivity. maternal mortality in Nigeria will reduce, because right now we are second highest globally in the whole world about in maternal mortality deaths. Also, for the baby will have all the nutrients completely satisfied with full natural food, such that the immunity is high. The baby will not be exposed to so many infections that come in. In fact, immunization starts from day 0 of the birth of the baby's life. When the baby is just born, we are encouraged to give BCG for against tuberculosis, hepatitis B, and oral polio vaccine from day 1. Okay, so now we are encouraging mothers at this point that maternal postpartum hemorrhage is highly preventable. How is it preventable? By initiating breastfeeding in the first 1 hour of life. For the baby will be happy to play with the mother. The baby will feel healthy, will be healthy. The immunity of the baby will become stronger, higher, and the baby is happy. If you see an exclusively breastfed baby, you will see that the baby does not get ill quickly, because when the baby is exposed to an environment with the infection, the body has already received antibodies from breast milk, and the baby too will be, when the baby is well, you know that the family is also empowered economically. The resources of going to the hospital every time my baby is having diarrhea, my baby is coughing, those things will not be there. So the mother will have what we call peace of mind. The family too will have peace of mind. And I want us to know that maybe we go to visit nursing mothers, they've given birth. Is the tradition in this place. Don't go and force the mother. It can make man no more. Why are you not giving your baby water? No. Research has shown that breast milk contains 70% water, if not 60 to 80. Let me put it that way, so that I will not be too specific. And this water is in the breast milk. It will give the baby enough nourishment. The baby will not be dehydrated. The baby will be fully hydrated. So the water you're giving, you will not pass through the stress of because all the water is there. The nutrients, these antibodies, everything in their correct proportion, and the small size of the stomach of the baby. As the baby is growing, you will notice that the baby sucks longer.
Okay.
Yes, the baby sucks longer as he's growing, because stomach increase. So you will not overfeed your baby. Okay, when you are doing breastfeeding.
Okay.
And so the baby's hand might even be on the breast, and the chin should touch the breast. Is fully inside the mouth of the baby.
Okay.
So that she grasps it. So that inside. And look at that. The mother should be very comfortable.
That's about the posture now.
Yes.
Okay.
The mother should sit in a comfortable posture such that you don't bend, you don't take the breast to the baby. The baby should be brought to breast and kept in aligned position like this, okay, so that you will not be tired of holding maybe in a framed position. It will affect the baby. And also, you should be able to sit for as long as the baby is suckling, because suckling will produce the let down reflex and you exchange so that's why we want the mouth of the baby to cover the nipple and the areola very well. So that so that we turn to the other side. Don't get used to giving only one side of the breast, because the breast milk is entering the two breasts. And also, when the breast on one side is not being given to the baby, you have what we call engorged breasts. when it's engorged, we want the baby mother to be happy. So happiness is the goal, and breastfeeding should be a successful process.
Okay, all right. Now let's talk about exclusivity. How long should this be, and for what reasons?
Okay, the breastfeeding we are encouraging now is exclusive breastfeeding for 6 months of life. 6 months. 6 months on me, the baby is growing. So after 6 months, we encourage the mothers to introduce complementary feeds. Like sometimes they can be okay. In fact, at the stage we even start introducing family meals. And test and see how is the baby tolerating. Is it purging the baby? Is the baby still enjoying the good health? Enjoy and very clean utensils. And as much as possible, we encourage cup, plate, and spoon. We discourage feeding bottle, because feeding bottle me forget me. But Anna in such a way that infection no after those say I remember feed the bottle but cup and spoon. So we are encouraging breastfeeding for 6 months. It will help the mother with child spacing. It will help the baby for good health and nutrition, and after that complementary feeding. Then we are also encouraging mothers to breastfeed for 2 years or even beyond. Okay. Because breastfeeding I need them out anyhow. So what's here in in the 2 years too, why we are even extending that? I in a community and people get say I'm crèche or get say like autumn or kindergarten, because it are maybe terabante in legacy boy 5 years. Even boy get good. Things have changed, so you have to move with changing times positively. So when we are moving with changing times, so positive impacts on the society. You don't know the tongue forward. By that 2 years, boy no, I know come so I can the tomfen, so that I for you right to I can forget you or get that to abo. I also need them. I want because when we do this, the youth is the future of this country, of our nation. So we want to have healthy youth, healthy communities, healthy population. That's why we encourage you to exclusively breastfeed for 6 months, and you continue breastfeeding for 2 years and beyond.
Okay, all right. Now, what's the nutritional value of breast milk compared to, the formulas, the processed formulas?
Okay, the processed formulas, they have tried, that's why we don't mention names. They have actually tried to make it as close to breast milk as possible. Okay, but there's still some variation in the protein, in the carbohydrates, and what we call enzymes. So that is why we say when we give breast milk and it is natural, the body of the baby, the enzymes, the digestive system of the baby will easily digest the natural components of breast milk easily, faster and more conveniently than the one in a manner produced, the manufactured one. There are proteins, there are carbohydrates, the antibodies is not as much in the processed formula. So the natural one and the natural digestive system of the baby will work in harmony more perfectly, efficiently, effectively than the processed formula that they have tried, the manufacturers have tried to imitate the breast milk, but it's never the same. It's like it's not, it is.
Okay.
Yes.
Okay. All right. Let's talk about challenges that some women face. Initiating breastfeeding, and then what can they do?
Thank you very much. The challenges are enormous, but it is individualized. That's why we are advocating prioritizing breastfeeding, creating sustainable support health systems. Why I add the health, so that it make maybe I can add a second for you, as I mentioned. Now the challenge is I work in your for no help. And when there is no assistance, that's a challenge. Atiki Yerefo, Atiki no Yendidia, Atiki that maybe there were other babies that came before this newborn, Atiki settling Rima. And if the husbands should encourage, or the spouses, their partners, should encourage the mother to breastfeed so that we could produce enough breast milk. So I make a needle comfortable. Maybe challenges amicably and naturally. As the baby comes, we call them bundle of joy. That has brought joy, peace. So another challenge is that we encourage you to continue putting the baby to breast. Now, there is what we call let down reflex. The hormones in the brain of the mother. Aya adoko aboke so that when we now put the baby to breast and the baby is suckling, that let down reflex has started. Suckling reflex will produce let down reflex, and breast milk will come, will start. It's okay, magic. I will not say that. In some mothers, in some pregnant mothers, they even start lactating before they put to bed. So that's why I talked about individualization. Then after 1 month, after one day, or after a few hours, it cannot last up to 1 month so that you don't starve your baby. So we encourage you to drink enough water, eat enough food. There's another thing that we have, what we call food insecurity. But say so you couldn't have stayed 9 months without eating. So that food will still be there. Another challenge is that some mothers say and that's another challenge about breastfeeding. You will feel the baby is not satisfied because you're not seeing the quantity the baby is suckling. As all you make the baby to belch. I'm a beke, I put to this other side. So the baby will obviously allow you to sleep because it's a natural process. Now you know what that's why we are advocating support. In some persons, in some homes, Facebook, internet, Instagram, but those are things that should make you happy. It's not something that you hang on internet. Because the time you'd have also rested, you were busy doing something else. We want everybody to encourage a nursing mother. And breastfeeding is an active process and it's a beautiful process because once you breastfeed satisfactorily, you will notice that if you that had that challenge, when the baby is resting, rest. Let there be people to help you. Sometimes in some homes, there is some fridge. Maybe your spouse has left, or maybe you didn't have a helper. I make a mission. You're not going to watch for the whole village. There are things now that could help. The people that could come in and help, nannies, mothers-in-law, relatives, let them help you with the other chores. It's not perfectly done. Because the one that should be perfectly done is this breastfeeding. Nobody will help you with the breastfeeding. So let them help you. To your own test. You will now say the baby did not allow me to sleep. You will now say the baby is suckling too much. Because when the baby rested, you should have rested. Now when you come to work, obviously your colleagues get YouTube. Because you need to suckle the baby. Okay, or express them. You had maybe taken the baby to create or kufo. Internet and phone over. Yeah, ben no bangasi on them do. No, boy, you too, as a nursing mother, I will also tell people who are helping me. Maybe I've left the baby at home. Boy, okay, another challenge now is maybe a woman is not well. Please go to the hospital. When you go to the hospital, you will be examined. They are in tests because of the complaint you must have given. They are in tests. So that immediately you go to the hospital, doctor, so that the drugs that we will be given, the medications that you will be given will not be contraindicated. You don't say, so am I a doctor or your caregivers? Okay. Perchance you are admitted. Okay, the baby will come with you. Those are support systems you are talking about. Can you separate? About 6 months of life. I don't. Or Akbc. I mean, you will see Kama Umamaba. As your name, Enoyan. I will hear it because the mother. Because Ida a kind of admitted, Ida may against you and the idea Yaki song about. But a toxin or young or what Ida may so. Now, another challenge has said that a can making a mantro. I can making a mantro meets what we grew up to hear. Say practice, say they can make us say, no, a Tayan, a Bakayan Diakinwa, then Bakayan Diakinwa, no, at all cop test. There's time for that. So the first 6 months of life, men or Bakayan Ferry, okay, I'm married to Fufu, it's an so, say practice, you work at Mecanero, you kid your uncle, and I know, but research on your issue, the army, yeke, eben uno in a band, the dark banobotum of a nursing mother, my first 6 months of life.
Okay, all right. Permit us, my guest, our resource person has to, switch languages so that everybody can understand. It's a very important week. It's a process that everyone goes through. Everyone gets to be breastfed right from when we were babies. So it's important to talk about this. Now, what about I've heard of mothers who have inverted nipples. What can they do? And then for the case of maternal mortality, what can happen? How can the baby be helped?
Okay, in cases of inverted nipples, that's another is a challenge as well. And before you have given birth, or a mother has given birth, we always encourage antenatal care. Antenatal clinic is also say care so you have been examined during so by then we have started telling you to pick it up. It's not right for you to have inverted nipple. For you for 9 months till the nipple is still inverted. I should have been able to be attending antenatal clinic. I've seen the midwives, the nurses, I've seen the doctor, and I've been told on what to do to pick it up. And we encourage our spouses, our partners, to suckle the breast that time when you are having your affair. We encourage that the partner should also suckle the breast. It helps to bring it out. Now, if the nipple remains permanently inverted, there's a challenge in that case because we are looking at symptoms and signs of breast cancer and or breast. If I will not really put cancer, but that's one of the symptoms and signs of breast cancer, and you should be reported. Permanent or the person was born like that. Now, engorge in preparation for childbirth and breastfeeding. The nipple will start coming out. You see that in some mothers, the areola, the black part gets darker. In fact, mothers, our grandmothers did not even need to do pregnancy tests. That's how they used to know children or mothers. So inverted nipple should not last that long, because if it lasts that long, you're now sending signals. We'll now do further tests to see in your by me take care of to me we'll now do scan, we'll do tests, we'll examine you for lumps. There are other things that could cause inverted nipple, not just a normal process.
Okay.
But per-chance, inverted nipple, me and our friend for tested, you could care, ababa. We encourage you to express.
Okay.
They are in their breast pumps now, so that I could miss breast milk. Breast milk is the first vaccine of life. Medical women, it's a breastfeeding. We have so many organizations. I don't want to mention that so that organization. So
I know that the office of the First Lady is doing so much about that.
I was about saying that there was a walk here in AKWA State on the 1st of August in collaboration with over 15 organizations. The Ministry of Health was there, Medical Women was there. We have Primary Healthcare Development Agency. There are many organizations, all health professionals were in that work, and that work was to create awareness, sensitization, and the First Lady designate gave a resounding talk, still advocating breastfeeding. And right now there is a project, IBOM Open Maternity Project, that Medical Women has partnered with, and all the agencies have partnered with in different local governments of Akwa State. And that is also to encourage this World Breastfeeding Week. So in that project, it's not just the 1 week, 1st to 7th. We will go to different local governments and it will extend. That's why we are talking about sustainability. And we are doing this project in the primary health facilities in the local government, so that this program is sustained, is carried beyond the 1st and to the 7th, and so that we can also tell mothers who were not opportuned to benefit on that 1st to 7th, so that they will know that breastfeeding is a priceless thing. You don't pay for it, and it will prevent maternal mortality. Maternal mortality in the sense that when you breastfeed, the womb gets contracted, contraction of the uterus and involution. It now returns to its normal position. It returns to its normal size, such that the mother will be healthy, and in such circumstances, near increased maternal mortality rates, because as in we want mothers to be alive, stay alive, nourish your baby. You have brought forth life. Why should you die? So Medical Women has zero tolerance to maternal mortality, and this postpartum hemorrhage is highly preventable. You don't buy it; it's natural. We encourage mothers, anything that will make you to stay alive and happy. You know, may stay alive. I mean, you know, like vegetable, and we want you to be healthy and alive. Help to build our nation. Help to build the state. In that instance, Ayenko will be happy to see the mother. You'll be happy to also go to your child's home, even as a mother-in-law, to encourage your daughter to breastfeed, or encourage your son, who is the spouse, to also encourage the wife to breastfeed the baby. It's like a continual process. As I've grown as a mother, I've gone to visit my child in Yokoman. So I purposely like to use Ukoman. I make out for what say I want a yenfo or yenfo man yung keke nebo ye ki no yeba ku no mo so that yeba yo okpono kem yen yo ka say ayene mo. So it's a continual process. Yang ni nam ya uno yeba mi in the first 6 months of life. I be say nemo and nem me free wo amere. So that the myths and misconceptions, like I say, back is said, do I will tell you, yes.
If unfortunately the mother's life is lost, how can the baby be helped?
Unfortunately, if the mother's life is lost, it's a time called foster breastfeeding. But in that circumstance, the person must be thoroughly screened. Screening for HIV because Ikado amaka antenatal. So Fredo I will do on the foster madami might not have done all those tests. So yeah, encouraging ICA screening, hepatitis, all those infections that could pass through blood, okay, sexually transmitted diseases.
Okay.
And in that circumstance, immediately possible no maybe a relation or an aunt or even the grandmother. But that person must be screened. Akbari buyoke after screening process is said don't KBIBO, okay. You hide a boy by now because you're not going to starve the baby. I mean because I said a heartbreaking thing that a mother has brought forth life and she passes. I say a shake 80. In fact, that baby should be in the hospital where the place is designed for it is called the nursery or special care baby unit. Okay, so Akbebado, things must be put in place because psychologically the trauma of the father that to lose the wife and we will not tell you immediately. But if it happens like that and there is a surrogate mother who wants to assist and screening about I would maybe accident or even more or less. Is in a blood transfusion. We don't just get blood from anywhere to transfuse somebody. That blood is thoroughly screened from the donor or if it was blood in the blood bank. So Anna, make sure ki bedo ado well screened. But they don't eating by a kapebi kinam and yek ake foro idiot. So that's what we have to say about that. But I will not stay here to say this particular infant formula is good. That lost. So that's why preventing maternal mortality is as important as preventing infant mortality.
Okay.
So because if you have to look at the two sides, that question you just asked me, okay, once uncle what happens to the mother? So it's two-way.
Okay.
That's why we encourage trained, skilled birth delivery. There should be at maximum a way to save that child, because the psychological trauma of man pass through maybe labor or cesarean section and he pass, unfortunately, to that a counselor model. You understand? And the emotional trauma reduced. So Nigeria, Medical Women Association of Nigeria, IBOM said, and national all over the world is advocating reduction in maternal and infant mortality, because those are the indices that make sure, that tell the world that and Nigeria is the second highest. Highest though, they were talking about 28.9%, which was so high. Now we have reduced, things are getting better, and there will be a time we will come down to 0 to 2%. We are now resource poor, low income setting, but there will be a time. That's why we advocate this advocacy, sensitization, creating awareness is ongoing, such that we reduce it to the barest minimum. The under 5 deaths and maternal mortality do reduce such that infants on the door less than 5 years. So healthy living, that's why breastfeeding immunity the epox infection of that no send out microbes. I don't any antibodies a box where antigen don't yes.
Okay, now you talked about expressing milk. How can expressed milk be preserved? How do we store it?
Thank you. In some settings where there is lights. You know, people there is solar. It can be seen in keep fridge or in a place that there is no NEPA. It's some coboro. Kamba usan. It's more. There's instances that we don't ants. No, that cup must have cover. And a cover ba. I mean, you need them to. Ete mama bendo no yen no wo etabe no yen kinwa. Nso me akama infection eti. Nwene you will be surprised that but once that cup is covered, sealed all round, they must be sealed all round the edges of the cup. Clean water. In facilities that communities that they do not have, but that cup and spoon and in a place that it must be clean, sterile. A person get fridge no di denge more freezer. A person no denge, perhaps a young person denge. I ask you how warm ye because anything that comes from the body is warm, normal temperature. But a person get fridge or make it kayadi denge. And as you ye as some ke cup or ke usa, it's a hot water and ye abante temperature in a bekan now. A mabu no yen tapado ke de move on from. Keep bangado. I blockade the move on me. So that after Jacob is that milk too cold, too hot for the baby. Sabana wobo ma express my bandam. And given no in my idea. In my walk why? Because the temperature must have changed. I give you the neighbor for the baby, and that's not what the baby has been taking when suckling. So we'll encourage us to keep in a clean place. I can be benefited a come back container, a cup. So that I know I'm a BD, keep the baby is taking clean milk. Because milk can go, if it is not well preserved, add a very rich source of bacterial growth. As an I can move me. I'm more for the time. I can't know you never thought. If I need a pedon, Utoro or Akko, please, I'm encouraging mothers, parents. That is still part of the creating sustainable health and supports. Yeah, I've been in a comfortable. Good back and fang, you got a back and fang, Mbioki can do. We do not want you to lose your baby because Akebo doctor I know exclusive breastfeeding. I know please let us make use of our health facilities. We have well-trained health care professionals in all the levels of health facilities, primary health facility, secondary, the tertiary. They are well trained, different stages of training, different cadres. Even the consultants, obstetrician and gynecology is still undergoing training. It's like I have courses, it's like I have seminars. So Benayan can for you. And when you work at Bonokan, say primary health care be handled. Refer, prompt referral. Refer. Ebo dika kamba for ibo ken bonnen facility nen ibenne udomi. So could refer fien. You now decide to go to maybe prayer homes. I don't want to say church. But I would nyemme I can for abasi. Ekebo ya and I'm fasting. I have seen a mother ekebo and I'm fasting. I can fast. I never fast. By the time they brought the child, the condition became so bad. But God in His infinite mercy did not allow the inevitable to happen. But in some cases, I say, "I don't want to do. I need to make a boy so. I can't make a boy so. I can't make cho. I can't make me. It be can't take a boy. Yedika. I need to a boko or eka. So abana would all know the because I mean, but the tanga frame challenge. Akemidi. Mbo. yang for ibo. The best that will happen to that child and to you, instead of running helter skelter. So that you don't have challenges with your parents-in-law. Or we want a conducive environment for the nursing mother. It was a even the mother say test.
Okay. Yes. Then for the express milk, how long are we supposed, can it be stored?
Okay, for the express milk as well. For a long time. So give the baby. So we don't want you to store for too long. I will not say 6 hours or 12 hours. That's too long. So Akbc make by 8 o'clock. Between 8 to 10, I know them metapano. I know man store well. Before, let's say 2 in most places, that's roughly about 6 hours. But I know so we don't want you to store overnight. Even
if it's in the refrigerator, it's like a fridge.
That's safer than in the middle. Then go, so you don't even need to store that one and keep overnight. More than Mobile said, express daily and keep. Instead of saying, let me express now and keep. Then Bangmada Kutum Edi Beneno. More than me no express and keep. They, at least in your workplace, they will not expect you to be there by 6 because there is that allowance. That's still creating a conducive environment. Yeah, it's okay. I can be by 8. I couldn't resume by 6 because there are some works you have to go and take over for working back at night. Then yeah, it's okay. Nothing but I know some space. I was okay be put here on such rigorous duties. Okay. Yes.
Okay. Now, as we begin to wind down, I know you talked earlier on about the significance of this year's theme. Okay, as a way of recap, can you talk to us about this year's theme and the significance, what's expected, families, government, workplaces, and all?
Thank you. The theme for 2025 World Breastfeeding Week, prioritizing breastfeeding, creating sustainable and support systems. Okay, now Medical Women has also brought it down to prioritizing breastfeeding, a lifeline against postpartum hemorrhage. So the support systems now bring to recap is that communities, homes, environments should be able to give a nursing mother the environment, enabling environment, a conducive environment, assistance at the community level, at the workplace level. We create crèche facilities and workplaces. But I also in a room where a nursing mother can keep her baby if it's permitted to bring the baby, if the mother is permitted to bring the baby to the workplace, or some places don't. It's not conducive. So these crèche facilities, as they are also part of enabling environment. Because then the workplace, okay, the workplace can also create a crèche facility in the workplace, so that crèche. What is crèche? Crèche is a place that you could keep a baby comfortable, a very comfortable place, clean, hygienically sound and standard. It can be created even in this facility here. You know, the big ones attached to schools or on their own. So facilities should be able to create crèche rooms. Now, then that's the facility or the workplace. Now, Nigeria has done it. The government has helped us by giving us 6 months maternity leave. And I want to encourage mothers to 6 months on me. You know, you have for I don't mind on all about my full war. I take care of Tronka, I put take it. No, take it, but I never them who do complain, get me, whatever. Who do go yemedi introduce at if shaman, come menable, to do, suitier, no, you never. More no, you never can many yem. The Tom may come, so you may come go. Edo, youthful good, healthy youth will grow into good, healthy adults. And they take over from us because the men of he retire. So that they take over from us when we retire in a strong, healthy population. That's about Nigeria. Globally, it is also known that as we are talking about breastfeeding, it's a global practice. World Health Organization takes care of the whole world. Other countries are doing the same so that our children can compete favorably with other people in other countries. I don't America. Form fans club. Form fans club how? When they are the population, it reduces infant mortality. Our children will grow up healthy and compete academically in sports, education, in science, in arts, in there are so many things that are all walks and facets of life.
Okay.
And when we compete like that, I mean, oh my God, but because you have received that first vaccine of life and completed your immunization, it's also another avenue immunization because that colostrum, that yellow milk, is the first vaccine. So the other immunizations, government more in a what the mother is passing through during this 6 months. I mean, after immunization, after the first the BCG, hepatitis, oral polio vaccine, I had again and again in 4 weeks. I'm another 4 weeks. May encourage support the nursing mother. No thing was saying immunize enemy. Emotional stress can make her develop one kind of ailment or the other. And another support system, still talking in line with how is the theme relevant, is that when mothers are happy, a mother is like the life wire of a home. I take care of the husband, the children who have already been there, will also have time to nurture herself and look fresh and look fine. Because if that was the first baby, I would like to have another one. And when I am happy and can take care of myself, my spouse will be happy. There will be a healthy relationship. So it goes round like that. Now, coming back home to postpartum hemorrhage, this is a preventable thing. Postpartum hemorrhage is preventable. What do I mean preventable? I don't bother with the peke. I couldn't demand them. Such that be a good tape and another pentel is often fatal. Oh my God! I isn't drip isn't blood. I see me IBOM. So this is avoidable. We have zero tolerance to postpartum hemorrhage. Okay. That is why we say that breastfeeding in the first hour of life is a lifeline against postpartum hemorrhage.
Okay.
Yes.
Okay, now 2 quick questions. Can mothers with HIV breastfeed? Can mothers with cancer breastfeed? Quickly.
Yes. Very, very good. Thank you very much. Mothers with HIV and cancers, before the lady became a mother, she was a pregnant woman. And HIV research has gone on such that there's what we call PMTCT, prevention of mother to child transmission. So the mother had started taking these medications such that I mean, Maddy man, I mean, it ain't the people as a pregnant woman. I saw what you name them because it's in blood now.
Okay.
The food I'm eating is entering the baby in the womb. So you don't me, I don't name them. So mothers with HIV should be, that's why I encourage that we should attend antenatal clinic so that I don't say if you need them, am I saying need them, I will be able, they did some infections that I would have not noticed will be detected through laboratory tests and treatments given accordingly, just like cancer that we mentioned, the diabetes, hypertension, all those ailments, tuberculosis, so that in fact in the case of tuberculosis it's taken for 6 months. After that, AKWA and nam test so already nam test because we are encouraged to continue to take these medications, go for checkups, and the test will be done again. So mothers with HIV must have started prevention of mother to child transmission. Then that's why I check my viral loan for so. In fact, in some instances, I'm a manner. Maybe no, there are medications even for the baby too, and they will tell you how to give, when to give, and when to stop, so that this your child that I had HIV is negative, completely negative. This is why we encourage mothers, please, in antenatal care, test. Everybody is dealing with one health challenge or the other. We do not say that we will laugh at you. That is why we are healthcare professionals. They will check you, examine you, you will carry the results and go back and show the doctor who requested for that laboratory test. The doctor, the healthcare giver, will be able to give you the medication according to that laboratory test, and you must take this treatment and come back for checkup so you can breastfeed your baby. If your doctor says go ahead, it depends on the level of the infection or the disease in the mother. But please, we encourage mothers to access healthcare facilities, be with trained, skilled healthcare professionals, and come for checkup and take your medications.
Okay, it's good to have that clarified. And then to wrap up, your parting shot for Akwa Ibom people, you know, it's breastfeeding week, beyond the week, and then all about, why we ought to breastfeed.
Thank you. My parting shot is that we should breastfeed our babies from within 1 hour of birth. That's very, very important, so that the baby does not lose that first vaccine I'm talking about, colostrum. Don't express it and throw away. I want to also encourage us exclusive breastfeeding in the first 6 months, and when complementary feeds are introduced, please continue breastfeeding for 2 years and above. Secondly, we should live in a healthy environment. The communities, the homes, the workplaces, and the country should give us a very beautiful environment to be able to breastfeed. And we want us to be happy. This will help to reduce maternal. The main goal is to reduce maternal mortality, to prevent postpartum hemorrhage, also to reduce infant mortality in Nigeria. Thank you very much.
All right, thank you very much. The President, Medical Women Association of Nigeria, Akwa Ibom State, Dr. Uduak Usanga, thank you very much.
Thank you very much
for coming
the
to
opportunity.
Share. For coming to share your wealth of knowledge with Akwa Ibom people.
Yes.
And I'm sure mothers will take to what you've said. Families will support, government will support, workplaces will support, so that we do our part, mothers do their part by breastfeeding their babies and then raising healthy children, healthy Nigerian children. Once again, thank you very much.
Thank you very much.
All right, we'll take a break here. Center Point AM45 continues. Do stay.
The Financial Services Regulation Coordinating Committee, FSRCC, in collaboration with the National Broadcasting Commission, NBC, wishes to draw the attention of the public to the worrisome increase in the activities of illegal